Hello, everyone. It's December the 2nd on Wednesday. Before I get into talking about the people that we've lost an additional 43 West Virginians since Monday. I'll get into that in just a second. We want to pass on, and I'll read every one as I have. We want to pass on our respects and our prayers to all those that we've lost and all those that are loved ones and the people that are all around them. But before I go there, I'd like to just say this, that we had a Charleston police officer shot in the face, that was responding to a parking complaint and everything. And her name, Cassie Johnson. She underwent 3 hours of, very, very serious surgery. She's in critical condition, and she's in the Charleston Area Medical Center. And as soon as I heard of this, the suspect, I think, is in custody and was also wounded, I think, but nevertheless, it's just unacceptable. It's just terribly sad. Here we have a police officer that is a hero in every way, as all of our police officers are, and all the great work that they're doing every single day. Just think, these are the people we call when we have an issue or a problem or a worry or concern. Shot in the face. Kathy and I ask you very sincerely with all in us to keep this wonderful officer, all of her loved ones in your prayers, and that she'll be okay. Absolutely, immediately when I heard about this, I immediately, let the Charleston City Police know that they had all the resources of the state police, and I was commanding all of our resources of our state police to assist and help them in every way. Again, I would ask you, all great West Virginians, to pray for a great, great, great hero, Cassie Johnson, a great police officer of our great communities in this state. Now, like I said, we have 43 additional deaths in West Virginia that total now 778 total deaths. I've told you many times about things that really grab our attention and really we just cling to and hold on to, and we remember them forever. I tell you about the Sago mine disaster, or the other terrific disasters or horrific disasters that we've had in our state. I go back to a night a long time ago, I guess 50 years ago now, where I was in the dorm at Marshall University at South Hall, when the calls came all around that the plane carrying our football team and a lot of great people with it had gone down right outside of the airport in Huntington. It stained and it has absolutely scarred us forever. And we carry that with us, and absolutely we saw a rebound of a university, a town, a community in Huntington, West Virginia, and we remember it always. 50 years ago this happened. 50 years ago we lost 75 on that plane. 75. Since Wednesday, we've lost 43. 43. Will these people be remembered in any way comparison to that plane crash? Probably not. And it's a shame. This is absolutely a tragedy that's going on all across our nation, and we've got to take it so seriously right here. It is unbelievable. Our 736th death is a 99-year-old male from Marshall County. Our 737th death, a 72-year-old male from Fayette County. Our 738th death, a 91-year-old male from Harrison County. Our 739th death, an 81-year-old male from Wood County. Our 740th death, an 88-year-old male from Raleigh County. Our 741st death, an 82-year-old female from Kanawha County. Our 742nd death, a 65-year-old male from Cabell County. Our 743rd death, a 59-year-old female from Mercer County. Our 744th death, a 90-year-old female from Pocahontas County. Our 745th death, a 69-year-old male from Mercer County. Our 746th death, a 77-year-old male from Harrison County. Our 747th death, a 55-year-old female from Harrison County. Our 748th death, a 60-year-old male from Boone County. Our 749th death, a 76-year-old female from Lincoln County. Our 750th death, a 68-year-old male from Berkeley County. Our 751st death, a 66-year-old female from Wyoming County. Our 752nd death, a 79-year-old female from Berkeley County. Our 753rd death, an 80-year-old female from Hancock County. Our 754th death, a 92-year-old female from Ritchie County. Our 755th death, a 74-year-old male from Mineral County. Our 756th death, an 83-year-old female from Mineral County. Our 757th death, a 77-year-old male from Mineral County. Our 758th death, a 73-year-old male from Lincoln County. Our 759th death, a 25-year-old female from Cabell County. Our 760th death, a 74-year-old male from Hampshire County. Our 761st death, a 61-year-old female from Wyoming County. Our 762nd death, a 59-year-old male from Pocahontas County. Our 763rd death, a 90-year-old female from Marshall County. Our 764th death, an 88-year-old female from Marshall County. Our 765th death, an 85-year-old male from Marshall County. Our 766th death, a 68-year-old female from Hancock County. Our 767th death, an 80-year-old female from Marshall County. Our 768th death, a 74-year-old male from Greenbrier County. Our 769th death, a 99-year-old female from Wetzel County. Our 770th death, a 95-year-old male from Wetzel County. Our 771st death, a 69-year-old female from McDowell County. Our 772nd death, an 82-year-old male from Preston County. Our 773rd death, an 89-year-old female from Berkeley County. Our 774th death, a 54-year-old male from Mineral County. Our 775th death, a 69-year-old female from Wayne County. Our 776th death, a 71-year-old female from Preston County. Our 777th death, a 72-year-old male from Preston County. Our 778th death, a 95-year-old female from Mineral County. Please don't let them become a number. Please don't let them become a statistic, West Virginia. God hears our prayers, and let him hear them all for all these great people. In the last 24 hours, we've had 1,087 new positive cases in West Virginia. Our positivity rate is 6.60 daily. Our cumulative rate is now at 3.69. Our active cases are up to 17,000, with 32,000 being recovered. We have a record high hospitalized patients now of 622. We have a record high of 164 in the ICU, and we continue to test a bundle of people in West Virginia. That in itself drives our positive numbers up. But really and truly, those that are hospitalized are growing. Those that are in the ICU growing. The number of deaths are unbelievable. You know, today our reproductive RT number is at 1.06, and we're the 29th best in the country. Man, if this is 29th best, I'd hate like crazy to see what the others are. But we see it every day. We see it on television. We see it every day. We have 8 counties now in the red: Ohio, Marshall, Mineral, Grant, Wirt, Mason, Wayne, and Wyoming County. I'm not going to read them all. We have 19 counties in the orange. We have almost identical in the state of West Virginia. We have, if this is exactly right, we have 27 counties in the red or the orange and 28 counties that aren't in that category. I want you to pay real close attention to this. This was assembled by the National Guard. And if what I've told you so far doesn't really get your attention, I hope and pray this does. The number of reported COVID cases in West Virginia has increased by 91% since Halloween. From Halloween, October 31st to November the 30th, we increased the number of COVID cases in West Virginia by 91%. Nearly half, 49% of the total cases during the COVID pandemic have occurred in the last 30 days. You know, 50% of all the reported deaths in West Virginia have occurred in the last 8 weeks. From October to November, West Virginia saw an increase of 73% in the reports of deaths associated with COVID. 47% of our deaths have occurred in our long-term care facilities or assisted living facilities. Half of our deaths have occurred from our nursing homes or our assisted living. We're averaging, now get this, we're averaging 13,300 tests that we're doing a day. You know, we really had high hopes that if we tested more and more, we'd be able to contact trace, we'd be able to identify the spreaders. That in itself would shut this thing down. And honest to God, in all means, to God above in every way, if we had not tested at this aggressive way, we would have had a catastrophe on our hands right now. It's bad enough the way it is. And it's not enough to just continue to test more and think that will solve everything. That's not going to solve everything. This absolutely is coming at us in every direction. The testing is helping, and it's helping tremendously. But absolutely, this alone is not going to solve what is happening all across our land. We hope and pray what will solve what is happening all across our land is the vaccine. And we know we're days away from it starting, but we're months away from it completing. And so we've got to continue to do every single thing we possibly can do to try to prevent this thing from continuing to spread. You know, I want to remind, and you know, if you heard me read these names as you do every day, I want to again remind everybody out there, you know, it's hard for me to believe that I'm 69 years old. Hard to believe that. I mean, it's impossible almost to believe it because I still feel like I'm 30, you know, and I still want to do all the things that I did when I was 30. And it's impossible for me to believe that, you know, gee, how life goes and the years roll on. But with all that, I would just say just this. It is proven over and over and over that the overwhelming majority of the people that are dying are in excess of 65 years of age. And, and especially those that are older than 65 and have some level of health conditions. I absolutely ask you in every way, for the next few weeks, please try with all in you to not get around others, to absolutely wear a mask at all times around others. Please try to get people to get your groceries or medications or whatever and get them delivered or whatever you have to do for the next absolutely few weeks. We'll absolutely get you vaccinated. If you will take the vaccines, we will absolutely get that done within the very, very short coming weeks or a couple of months. Absolutely, please recognize your situation and please try to take heed. Okay, from a vaccine update and everything, I was on the call, I guess it was Monday. I was on the call, with the vice president and the other governors. We went through how the distribution is going to roll out. We know that the first rollout is going to come from Pfizer. It's going to come probably on December the 14th instead of December the 12th. We should start to have vaccines very, very soon. All the vaccine task force and advisory council is all over this. They'll be doing a phenomenal job. First and foremost, we've got to make sure that our healthcare system, our healthcare workers and everything, that we continue to maintain and take care of those people first and foremost, because they're looking out after every one of us. And so, we'll be all over this. We'll be all over, taking care of our assisted living and our nursing homes and our elderly people and those that are most exposed. First responders will fall in right there, right after our medical people, and we'll be rolling out every bit of that. We're pushing and pushing to get more and more vaccines and everything, but the bottom line, here's what's going to happen. You're going to have whatever Pfizer comes out with, and we're allocated in West Virginia, you're going to have that, sometime the tail end of next week or the first day of the next week. Right behind that, a week later, you're going to have Moderna step up, and you're going to start getting their vaccines are going to roll in then. But in addition to that, Pfizer's vaccine will continue on a weekly basis every week, and it will continue to grow as Moderna will continue to grow, and that's the way it all comes down. Really, I told somebody this the other day, but I wish so much. The likelihood now is the way more and more and more the evidence is coming, and that was my belief. Why be in a hurry? Be sure that all the votes are counted and everything is correct and everything. But the way it goes, the more and more evidence is coming in, it surely looks like that that we're going to end up, or President-elect Biden will be our president, and there's still issues out there, and we're still, I'm still a real believer that why be in such a hurry? We've still got some time and everything, and we'll just kind of, bide our time and do our work and everything, and continue to really pay attention to all the other work. We'll end up with a president on January the 20th or whatever the date may be, and I'm sure the transition, if it's President Biden, will take place, and it will take place in an honorable way. At least I hope and pray it will, and everything. And if by some chance something comes up that we don't know about right now, we need to consider, and we need to make sure that we do all we possibly can to assure that we had a good and appropriate election. But with all that being said, I do think that if you could be on the call, and you had been on the calls, and this, I want to pass on these accolades to our vice president and to our president and to all that they did. And I want you to pay attention here, because I've been on so many calls and I've been seeing so much, and and a lot of it's on Zoom, where you're looking right into the situation room, and you've got, Dr. Fauci, and you've got Dr. Birx, and you've got, all the generals and everybody that are sitting there and they're reporting on what they're doing. I'm telling you, and I am telling you, if you wouldn't be impressed, then you'd just be so wrong. It's unbelievable. You just think back when all this thing happened, boom, boom. We didn't have the PPE, all the face shields. We didn't have the mask. We didn't have anything like that across this land, because China gobbled it up. And basically, we were in one whale of a mess, and our president and all these people moved on it like you can't imagine. I mean, the expediency and how they pulled that off, unbelievable. And then, right with that, our entire economy in this country could have been on the verge of a total collapse. A total collapse. Now, it almost happened in like 2008, and we learned a lot probably from what happened in 2008, and we had to move, didn't we? We had to move right now. We had to move in every way, with the PPP that went out, with all the unemployment stuff that went out, with everything in the world that was going on, because we had to shut down to grab a hold of this. These people deserve a lot of credit. And right now, this vaccine is going to roll out, and they're doing it like an attack on our nation in a wartime situation. To watch these generals and how they perform and everything, and to watch the leadership of this country in real leadership times, they've done a heck of a job. And so soon we'll have a vaccine, and it will be rolled out, and it will be handled by our West Virginians and our leadership of our General Hoyer and so many, and it'll be handled in a really great way. Another thing on the call, they urged me and they urged all the governors to tell us, to tell our citizens all across our land, to urge them to go and give blood, especially if you are a recovered person from having COVID, because from the standpoint of the antibodies or whatever it may be, your blood could be in such high demand, it's unbelievable. So please, please consider going and giving blood. We've got an announcement today about free in-home testing. This is in addition to all the free testing that we're already offering all over the place. But I'm excited today to announce that we are now offering free in-home COVID testing. It's brand new. It's up on your screen right now. We have partnered with Vault Health to bring this convenient test that is mailed directly to your home. These are saliva-based test kits available to West Virginia residents at no cost to them. Any fees will be waived once a West Virginia address is entered on the Vault Health site. And to order your kit and see all the free testing information, go to our coronavirus website and get this. The way I think all this works is this. They mail you a kit, you get on some kind of call with them and everything to where they can walk you through and see you go through this process, and then if it's done properly, you mail the kit back and we'll get you a test result back very quickly. Again, I encourage people to get tested after the Thanksgiving holidays. All the free testing stuff's up on the map. Again, I thank Walgreens and Fruth for all that they're doing and at our drive-through pharmacy testing. They've done great stuff. Of the face mask mandatory requirement in going in public buildings, we sure want to amp up every possibility that we can to make sure people got masks on when they're out in public buildings, and so please try with all in you to We don't need this to be, the star of the game show. We need this to be just an effort to where we're not hauling people to jail. We're not absolutely doing all those things. We need, though, to absolutely urge and know that this is an executive order that is mandatory from the governor. Our school outbreaks still are really pretty dadgum good. We have 25 outbreaks and 101 confirmed cases in our public school system. Our long-term care facilities, we have 110 outbreaks there. Our churches, we have 17 outbreaks reported in 13 counties. That's down just a little bit, but that's in Berkeley, Cabell, Fayette, Harrison, Jackson, Kanawha, Marion, Mingo, Raleigh, Taylor, Wayne, Wood, and Wyoming counties. You know the drill. A pew in between you, mask on all the time. If you're an elderly person, I would, just to tell it like it is, unless you just have, and I totally understand the need. I am very, very proud to tell you that I'm a Christian, and I'm blessed in every way, and I can tell you that the need for church is a need beyond belief. But I can tell you that if you're over 60, 65 years of age, you can get your church services at home for a while. Please think really hard about doing that. Our corrections update is corrections is seeing the situation improve. At Prunytown Correctional Center, we're down to 5 active cases there, down from 23. At Parkersburg Correctional, we're down to 4. It had 16 on Monday. There are now 57 at the Denmark Correctional Hospital, 43 cases at the Northern Correctional Facility and neighboring regional jail. Those facilities have seen slight reductions since Monday. The total active cases in our state and inmates is 113. The total staff cases is 63. The Department of Corrections continues to follow all the COVID response plans, and the inmates are quarantined and isolated as necessary, and the National Guard is sanitizing the affected facilities, starting with Parkersburg today. The flu vaccine, continues to be available. The 15th of December is a deadline for which we can start and properly guarantee that we can process your application, from the cities and the counties. We've now exceeded $195 million that have been awarded to the cities and counties. We have readjusted our CARES allocation number up from $200 million to $225 to be able to cover what comes in between now and the 15th of December. But we'll continue to follow all the guidelines to make sure that we're doing everything by the book, by the federal guidelines, and get those monies out. I know they've been a lifeline, and the other flip side of it is I truly believe that there's another stimulus package coming. I have no idea what will come, but because it's all over the board right now. You see what's going on in D.C., and, just to tell it like it is, it's, at times it's very, very frustrating, to say the least, because you see two sides, Republicans and Democrats, fighting with one another, trying to one-up one another on, what they can do politically and everything else. And at the same time, at the very time, you got people that are sitting here worried to death how they're going to pay their power bill, how they're going to pay their car payment, how they're going to pay their rent. I mean, what is going to happen to my business? I'm a restaurant, and what's going to happen? I'm just on a thread. I'm getting ready to lose my business and everything. The bank's hounding me like crazy. I don't have any way to pay them. And these people are sitting up there playing games and doing their typical politic junk. And it makes me sick, to tell you the truth, because we got a lot of people really, really hurting. I don't believe in that politics stuff. I absolutely believe that we should be doing the very best that we can possibly be doing for our people. And a lot of people like to talk that, but a lot of people don't walk it. I mean, it really boils right down to that. Watch what's going on. Watch what's going on. I have said 1,000 times over, I don't care if you're a Republican or a Democrat. I only care about you being a good West Virginian and wanting good stuff, great stuff. I personally believe the Republican Party is going to take us further down the trail, but at the same time, all I want is goodness for all of us. I can't stand this politics stuff. You know, nevertheless, that's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you and good afternoon. I will just touch on a couple of things the governor said and be shorter than usual today, because I think the governor has really articulated very well what we need to do. You know, we continue to see more West Virginians test positive for COVID-19 on a daily basis. We know that 2 to 4 weeks after we see an increase in numbers of people testing positive, that we can anticipate having people get sick, go to the hospital, and die from COVID-19. And we have seen a number of deaths. The governor read all of the names, and that to me is not acceptable for our state. And I know we have a very vulnerable state, and we have a very sick state, but we can continue to do better to protect the health of these vulnerable people. Governor mentioned that in nursing homes, assisted living facilities, we see a great number of these deaths, and with the governor's orders, we are now testing twice weekly in these facilities, and we've identified a number of people that have carried infection, which has been very helpful with our testing. The governor mentioned that we are continuing to add new ways to test for West Virginians so that we can reach more people where they are, including the new Vault test. And this new at-home test is ordered, as the governor said, from the DHHR site. Once the Vault tube and sample kit comes to your home, then you log on to a computer connection and then log on your information, and you'll get a video visit from a expert from Vault who will walk you through the steps to collect the saliva sample in the tube that's enclosed, and then have you screw on the secondary cap that has a preservative. You'll mix that up, and then you'll put the Vault tube in a pre-packaged mailing envelope that will go back to Vault, and then within 24 to 48 hours, you will get your result as negative or positive, and it will either be given to you as a call, a text, or an email, depending on what information you include. If you don't have access to the internet connection, that can be done over the phone as well. And a couple of caveats that you'll need to know is you shouldn't have anything to eat or to drink or to smoke or chew, including water, for 30 minutes before that you're going to collect the sample, so that your saliva will be richer with the genetic material from the virus, if you would have it, and not be diluted by whatever you're eating, smoking, chewing, or drinking. And so as we look at methods that get more capability, more capacity to people in a more convenient way, this is the start of continuing to evolve that strategy. And as the governor said, we want to continue to test very aggressively, and we have done that through DHHR, through the National Guard, but we also want to start to reduce the requirement to have so many people in lines that people drive through and do the test for people. So we're also working on methods where people can administer their own swab tests under supervision, the saliva tests that can be done at home. So this is the next step for us to continue to amplify the ease and convenience of getting people tested, but also to save our vital workforce for other really important missions like the vaccine distribution mission. For West Virginians, I think the governor said it, but I'm just going to say it, and this will be my last comment, that the vaccine is coming. The UK, United Kingdom just approved the use of the Pfizer vaccine, and we do anticipate that will be happening in the US soon, as well as the Moderna vaccine. But as the governor said, we'll have early doses in December, but we will be vaccinating people through the mid part to even perhaps the third quarter or beyond of 2021 to get everybody an opportunity to be vaccinated. As the FDA, the Federal Drug Administration, looks at these vaccines, they're going to do an incredible, thorough job at looking at all of the information. And at this point, it looks like that both the Pfizer and the Moderna vaccine are very safe and extremely effective in not only reducing and preventing the disease, people from getting COVID-19, but protecting even people that have gotten COVID-19, a very small number of people, 4% or so, or 4 to 6% of the people that got either the Pfizer or the Moderna vaccine. It's kept them from getting really sick with COVID, and it's kept them from dying. So we know these vaccines are really important, but the vaccine alone is not what's important. It's getting people vaccinated. And so as we roll out this plan for priority of our ability to maintain our healthcare capacity and function for our hospitals so that we don't surge the hospitals as we've seen in New York City and other places, and we protect the most vulnerable. We reduce deaths at the same time. And yesterday, the CDC group came out and said hospital capacity and nursing home residents were the two most important groups to vaccinate. And we will take their advice and be consistent, I think, when we roll out that prioritization plan in these two groups as high priorities for us, hospital workers and hospitals, particularly the hospital emergency departments, ICUs, and COVID units, and the people at the highest risk of dying, the residents of nursing home and assisted living. But when you have an opportunity to get vaccinated, we absolutely encourage each of you to get vaccinated, as we will as well, because the vaccines are really not the key. Vaccinations are the key. So West Virginia, keep at it. Keep up the commitment to wear your mask and follow the right rules for distancing and avoiding crowds and closed indoor spaces, particularly where people can take off their mask. And that's really important for vulnerable West Virginians, people over 65, people that have pre-existing diseases like heart disease, lung disease, high blood pressure, obesity, blood clotting problems, anybody who has a disease that compromises their immune system. Avoid indoor places where people aren't wearing their mask, and avoid being close to people that you don't live with all the time. We will see this through, and if we all rally to this fire that we're seeing now, by acting responsibly and altruistically, West Virginia will continue to set the bar for everybody else. So thank you so much.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Quick update. Joint Interagency Task Force is meeting today, continuing to work planning process. Tomorrow, we will do a tabletop exercise to work through some of the processes and procedures. Also later today, team led by Caitlin Cohn from DHHR, Joe Peel from the National Guard will brief CDC on our initial planning processes. On 4 December, they will brief Operation Warp Speed team to give them an update and further synchronize our efforts. I want to highlight what the governor and Dr. Marsh talked about earlier, and thank the DHHR team for the great work in adding testing capacity, and particularly the self-testing capacity, which will now allow us to pivot National Guard assets to begin to work the planning and the execution of the vaccine distribution. Thank you.
All right, thank you, General. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Thank you. Good afternoon, everyone. It seems like I say thank you a lot on these briefings. The truth is we can't thank our local health departments and our National Guard enough. They have done a tremendous job in terms of testing across the state of West Virginia. As of 2 days ago, Monday, we were 11th in the country in terms of testing. Governor made that a priority, and we have pushed that as hard as we could push. Our initial limitations on testing were test kits, the availability of reagents, swabs, et cetera. The next limitation became laboratory services across the state and across the country. And now we're looking at a workforce situation that is limited, both by local health departments and at the Guard and at DHHR. So the efforts you've heard today that the governor rolled out in terms of online ordering of test kits is significant. Our pharmacies have stepped up. We want to again thank Walgreens and Fruth for helping us with testing and helping to make up for those testing areas across the state where we had difficulty reaching. Also, I want to mention we've had some concerns with regard to evening testing throughout the state. We're trying to move folks into areas and provide evening testing. Now that we have the Vault product online, we hope that helps folks. You'll find the testing information on our website on the testing page above the map. It says change display, and you can get a list of sites in every county. So that information is readily available either on the map or as a list. And again, the Vault information is now live and is available online as well. So we thank everyone again. Again, local health departments have really stepped up and are doing just a tremendous job out there in terms of testing, and we couldn't do any of this without the Guard. So we thank you both.
All right, thank you, Secretary. And last to Dr. Aina Amjad, our State Health Officer.
Good afternoon. We received this question from a citizen, and we get it often about large gatherings and planning for dinners. And with the Christmas season coming up and holidays, parties and such, we wanted to bring this up. We do not recommend having large indoor gatherings for any type of parties or organizations. Some recommendations would be to have maybe a drive-through meal pickup if you're going to host any type of event. Maybe you can have people drive by and pick up the meal to go. Other situations would be to have, if you're going to have such an event, to have the seating arrangements 6 feet or greater apart from family members who do not live in the same household. Not to have a buffet style of feeding arrangements, because that is one way to have increased transmission. Also, to have people wear their masks at all times unless they're going to be eating. But having a large dinner party, especially during this holiday season, is really not recommended, especially indoors. But we did want to mention that we do get a lot of questions, and that was brought up. Thank you.
All right, thank you, Dr. Amjad. Governor, I'll turn it back to you.
Okay, in looking at 43 deaths and looking at the numbers, that we're having to deal with in regard to this terrible pandemic, we can sometimes overlook, the fact that, some good news that we should have reported. I should have done this earlier and everything, but I didn't, because I just skipped over it, to tell you the truth. But I want to tell you this from the standpoint of how the state is running and how the state is responding and doing economically. This should be a day of celebration from an economic standpoint beyond belief. We brought out the flowers and the necklaces and everything else, when we had great, economic numbers way pre-COVID. It seems like that we're just all overwhelmed by the fact that we're losing all these people, and we should stay dialed right there. But I want to just say this, from the standpoint of the state, we came in November another $20.1 million above budget. We came in, that makes 5 straight months that we've come in beginning. This fiscal year started on July the 1st. Our year end is June the 30th, and we some way got through moving the income tax money and moving, and dealing with COVID last year, and ran across the finish line with a surplus, which was unbelievable, to tell you the truth. But since that time, we we have now produced 5 consecutive months of surplus after surplus in West Virginia. We're now at $131.7 million of surplus, and I could go on and on and on about it. It's something that we should really be proud of in West Virginia. We're continuing to amaze the world. I mean, we're continuing to be that diamond in the rough that I have wanted so badly. We're truly marketing ourselves. We're marketing ourselves from the standpoint of our diversification and all the different things, especially in tourism, and bringing all the folks that know about our state, wanting to come to our state. You know, we made several big international type announcements in the last week that are going to bring lots and lots more job opportunities to us, and it's just going to keep on going. You know, we hope and pray that this terrible pandemic will leave us, but as it leaves, absolutely, without any question, you know, the world in the last probably couple of years, it started beginning to grow, and literally every day that goes by, West Virginia is becoming more and more the place where people will come. Now, with all that, the only other thing I'd report is just this, that our consumer tax collections are up, our personal income tax collections are up, our corporate net income tax collections up. You know, we're holding our own on severance, but the great part about that is just this. We don't want to give up on our coal miners or our gas workers or all that. We don't want to give up on any part of any of that, do we? Of course we don't. But at the end of the day, if we're doing this way, from the standpoint of where we are today, with our natural resources that are maybe a little bit held back and a little bit, you know, not peaking the way we want at this time, if we can get that sector cranking and we can continue to do things like Hyperloop and all the manufacturing possibilities that are coming within West Virginia, absolutely, this state is really on the move. I could not be any more proud, and really and truly, you should be just that, because West Virginians, you've made it that way. You've made it. All I've done is the coach, or maybe the guy that's maybe mapped out which way the boat needs to go and everything. But you're doing the work, and I can't thank you enough. You should be really, really proud. Honest to Pete, these kind of numbers are unheard of. And don't let somebody, you know, report in the Charleston Gazette or whatever that the only reason these numbers are up is because the money is coming from the federal government or whatever. That's hogwash. That's hogwash. West Virginia, you're doing great stuff. They try every way in the world to try to come up with some way to tell anything but the truth. And the truth is just this, really, and this is all there is to it. When we rolled in the door, we set on a mission to turn you loose, to absolutely do stuff with our roads, and to turn you loose from an education standpoint, and turn you loose, West Virginia, because the world needed to see just how good you really are. We became proud of our own pond, did we not? We became frogs that were proud of our pond. And really and truly, don't let anybody push you down with their garbage and everything. Really and truly, West Virginia, you're doing great. Just keep it up. We'll some way, somehow get through this terrible pandemic. We got to stay together. And I'm sorry I just skipped over this and everything, but again, it's tough sitting here reading out 43 great West Virginians that we've lost and all the stuff. This is tough stuff right now in West Virginia, so just hang in there. We're going to get through it.
All right, thank you, Governor. We'll now go to questions from members of the media. The first today from Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, when asked about the approaching federal deadline for using CARES Act funding, you've talked in terms of buckets, which I interpreted to mean allocations. If those millions of dollars are allocated but not yet spent by the federal deadline at the end of the year, do you consider the money safe from being clawed back from the federal government? Thank you.
Brad, I with all in me, all my people, all my experts with all in us, believe we are on rock solid ground The money's not going to be clawed back, and I guess, anything can happen. We can get hit tonight by a meteorite, but really and truly, we got this. We got this. It's good.
All right, thanks, Brad. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, Governor. You mentioned during the briefings about public schools, and you mentioned just about every time how relatively safe they are. That being said, there's still concern, obviously, among teachers who are dealing with this stuff on a daily basis. So has there been any more thought to increasing testing of frontline educators along with similar to your plans that you've done now with nursing home workers to protect that population, to set up some sort of program where teachers can be tested on a regular basis in a structured way, you go into certain schools, certain areas, and test them on certain days? I know that our testing capabilities have been stretched already, but is there any more room to include that specific group, which might be able to help alleviate some of their fears and concerns as they continue educating West Virginia students? Thank you, sir.
Well, Kenny, it's a good point, and really we have dramatically, amped up our testing, and we continue to try to cooperate and work with everybody as best we possibly can. We need their cooperation as well and everything, but we absolutely, it's a good point. I'd be for it, and from the standpoint of testing, you got testing available everywhere. If they're really wanting to get a test, I can't imagine that anybody that's in the state of West Virginia today that's wanting to get a test can't get a test. And so, but from the standpoint of structuring, some kind of testing on a weekly basis to make sure we get everybody tested, and we're working, with all the different counties, to try to come up with a way that we can do a weekly type testing, and I think it's a great idea. I know we're already working on it, but we don't have it finalized yet.
All right, thank you, Kenny. Next to Steve Adams with Ogden Newspapers.
Steve Adams of Ogden Newspapers. You can all hear me, right?
We can.
Awesome. Hey, can someone talk to me a little bit more about the Vault Health deal, how it came about? I know Minnesota does something very, pretty much the same exact thing, looking into it. And I know that they had to put some caps on their program just for the sheer number of requests. So A, can someone tell me a little bit about how this came about? And B, what type of limitations are on this program? Can one person request a test each week, perhaps, or something along those lines? And I know some people get a little leery about multiple testing, but I would imagine sooner or later we're going to be moving to, at-home tests that you could pick up from any pharmacy sooner or later, sort of similar to pregnancy tests. So is this sort of direction we're going into, where people can obviously go get a test and get some results back relatively quickly? Thank you.
Stephen, this is Jim, but from the standpoint, and I'm going to defer to Bill Crouch on this, but from the standpoint of limitation and whatever like that, we'll have to watch, and I want Bill to hear me on this. We'll have to monitor, how we're able to allow people or get these number of tests out and everything, just from the standpoint that, in watching all the dollars that we have and the dollars that are available to us, we got to be careful to really monitor what we do and to do it with the right guidelines. But Secretary Crouch, you can probably elaborate on this more than I.
Thank you, Governor. And the Governor's exactly right. We're going to monitor this. We're going to roll this out and see how it goes over the next week or so, see what the response is from citizens of West Virginia. At some point, we may end up having to cap this, but we certainly hope not. Our efforts are to test often and to test everyone who wants a test. So again, we're 11th in the country. We want to be first. We want to be the best in terms of testing, to identify as many people as we can, to to make sure that we reduce community spread as much as possible. On the website, if you look at the DHHR website itself, there is a find testing locations at the top in red. If you test on that, just so individuals, just so folks will know how to get to that. And then you scroll down just a little, there is a map which the governor speaks to, talks about every briefing, that has all of the test sites in the state. Right above that is check here for information on Vault in-home testing. So it's on the testing page, easy for folks to find. For now, we want everyone to test, especially individuals who have had problems testing because of tests only being available in certain areas in the evening. This will allow you to test. So we are going to monitor this. We'll keep you up to date on this every briefing session, every press briefing to let you know where we are on that. So thank you. Good question. Thank you.
All right, thank you, Steve. Next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. Dave Mistich, West Virginia Public Broadcasting. My question is about the rollout of the vaccine. Obviously, whenever it comes to like nursing homes or prisons, you're sort of limited in having to go to those places to offer a vaccine. But with the general public, with healthcare workers, are we going to set up some sort of center for people to go to get vaccinated? Are they going to have to go directly to their healthcare provider? What sort of guidance are healthcare workers and the general public going to have as far as getting to take their turn to get the vaccine, so to speak?
Dave, I'm gonna defer to General Hoyer. General, you can answer this better than anyone, because our great military is in charge in lots of different ways here. They're going to knock it out of the park, and so General, take it over.
Yes, sir, Governor. So, Dave, to answer your question, be multiple ways depending on the various populations. Initially, as the governor laid out, focus on nursing homes. And as he pointed out in the numbers, 47% of all of our deaths are from nursing home and assisted living, along with maintaining the integrity of our acute care healthcare system. As you point out, those will be delivered to those locations, and there are plans being developed with the Nursing Home Association as well as the Hospital Association. We have regular calls with those groups. When you get towards the general public distribution, then there'll be a variety of different methods that will have to be used. And again, this is going to change and evolve over time. This is even unlike flu vaccine. We haven't had a pandemic like this for 100 years, so we're going to have to continue to evolve this as we go forward to make sure we do the most efficient and effective ways of getting out to the appropriate populations.
All right, thank you, Dave. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to follow up on Stephen's question about the in-home test. How accurate are these compared to the tests we've been using? And in this initial phase, when we're rolling it out, are we going to try and limit this to older folks and the folks that can't get out, or are we asking everyone to go ahead and start taking advantage of this? Thank you.
I think, Bill, you can answer again, and Charles, my response is going to be just as simple as this. You gotta juggle a lot of balls in my position, and you gotta absolutely make sure that the economies work. If just because we have a newfangled idea, and the idea may be great, but let's just exaggerate and make to make a point. Let's just say the newfangled idea was going to cost us $300 million, and we had testing available in lots of different areas and everything, and without limiting, using your question, Charles, without limiting this to people that can't get out or people that shouldn't get out or whatever it may be like this, to just turn it loose, and it was going to cost $100 million or whatever the number may be, and you didn't have that, well, you can't do that. You've got to do what you're saying. You've got to limit it and everything. But I think with the whole concept is right now, just see what the response level is and see that we have the dollars to be able to handle that. But Secretary Crouch, go ahead.
Yes, Governor. And again, the governor's right on target with that answer. Let me go back to Steve Adams' initial question, which was who came up with this. I apologize, Steve, I left that out. We have a health command in DHHR that we have a call every morning with about 30 folks on there. I can't tell you who found out, recognized that this was an option out there across the country. We know another state that's doing this right now, possibly several. We found out about it. First I heard about it was just probably less than 2 weeks ago, and we jumped on this and looked at it very quickly. I'll also mention we have one more take-home company that provides tests that can be taken in the home that will be online within a couple of weeks or so. So we're not just stopping with Vault here. So, and Charles, with regard to your question, this is a PCR test. This is a gold standard. The accuracy of this test should be comparable to other PCR tests out there and those that we're doing through the drive-in lanes, et cetera. And again, the governor is correct. We're going to have to monitor this and see how this goes. There's no limitation in terms of age or individuals who can access this test. It's available to anyone online right now that chooses to use that option. So again, we want West Virginia's test. It's how we fight this disease right now, that and masks. So again, please wear your mask and please test. Thank you.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I want to throw out a scenario here because I think there may be a funding gap. If the state truly spends down all of the CARES Act money by December 31st, so it doesn't have to give back to Washington, we may be looking at another 6 weeks before Congress and the new president pass an additional stimulus package. In that month to 6 week gap, where are we going to get the money to pay for the testing and other things that the costs associated with this without the federal help for that period of time?
Well, Mark, yes, a really intelligent question because I guess anything is possible with what's going on, and and I was pretty critical of the way that I was referring to what's going on with all the politics in D.C. But if in fact we do spend the CARES money down, of which we've got to do, if in fact we do that, then what's the backup? And you can't get caught, with no backup if you're in my position. Well, my position is really simple. The backup is how we're doing in the state of West Virginia. The backup is how we moved the income tax money from April 15th into July the 15th. The backup is we have dollars. Now, to be able to spend those dollars, at that point in time, if we get to that point in time and Congress and the feds have not moved, we'll have to call ourselves into a special session to be able to evaluate and to be able to get authorization to be able to take those dollars and to be able to reappropriate them and be able to spend them and take care of our people. But it's a great question, and it's something that we're already on top of, but not many people would know it without you bringing it up, but it's a very good question.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Question about the logistics of the vaccine rollout, and I guess it would go to General Hoyer as well. Do you know how quickly and what kind of volume you're going to get vaccine into West Virginia, and whether you will be able to take care of the most vulnerable populations early on, or will this be a multi-month situation? And is there a pecking order? And one final one, once you get vaccinated, do you get a card that kind of IDs you as being a vaccine recipient?
Governor, you want me to go ahead?
Yes, sir, please.
So, Paul, a couple of things. Number one is the calls that I referenced with CDC and Operation Warp Speed will give us more fidelity at the end of this week as to the numbers that are coming from the both the Pfizer and potentially the Moderna, assuming it gets its approval as well, and the rollout based on time, space, and distance when those will come. So we're planning those based on priorities. We will finalize with the governor later this week more specifics on that rollout, and we'll have more for you next week on that. There is a federal system that is set up that enters individuals into the system to track not just that they've been vaccinated, but as remember too that both of these are a 2-shot set, and one of them is 21 days and one of them is 28 days. So a lot of oversight to make sure that the right folks get the right second shot of vaccine going forward. So there is a system to track that. We are also looking in West Virginia to be able to have a backup to that should there be an issue with the system.
All right, thank you, Paul. Last question today from Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. I apologize for about the first half of the briefing. I was covering another virtual meeting, so I may have missed this, but can you update the status on the more stringent mitigation measures that were discussed on Monday?
I think Phil, I could defer to our medical panel or medical experts, but here's the thing, Phil, that we moved to take off the table from our hospitals, from a standpoint of the elective surgeries that weren't requiring, that were requiring rather overnight maybe stays in the hospital, so we would make sure that we had hospital capacities and we wouldn't endanger that. From the standpoint of how we're looking across the state, from the standpoint of, whether it be a good idea to do a wholesale shutdown, well, we're not there by any stretch of the imagination. Would it be smart to continue to look and monitor the standpoint of what our neighbors are doing in other states, from the standpoint of maybe restricting hours in our bars, or maybe even do some further restricting, in our indoor dining. But Phil, from my standpoint, I am trying with all in me to keep West Virginia open, but keep us absolutely safe. And with everything in me, I am trying to not have to put more stringent requirements on us that we cannot show that are going to make a significant difference. That's the whole key right here. Really and truly, and I've said it this way, and this is just an exaggerated example, but you could go in Mineral County and you could say in Mineral County, well, we're going to shut the bars down there, period. Or we're going to change the hours there, period. And really and truly what we're going to have happen then is we're going to have people drive across county lines, and the ultimate impact of what we're doing is minimal. Very, very minimal, if anything. And it has a repercussion on the other side where we've got people being laid off, and we've got all kinds of issues, from the standpoint of the other problems that we have in life, drugs and everything else that we're contending with. So from the standpoint of what I see, my juggling act is, on one side, I do not want us to shut things down that cripple us and hurt us economically, because it has consequences. It has real consequences. And on the other side, you've got to try to do whatever you have to do to be safe. Now, ultimately, we all know what would make us, what would really make the most difference is shut everything down. Well, of course we're not going to do that. Of course you're not going to do that. At least we hope and pray we're not going to have to do that. But right now, I think we're okay. I think we're okay. It's tough. It's really, really tough. We just got to really buckle down on the mask, and we got to buckle down in every way we possibly can, and we're just within days. We're within days. We don't need to divide us anymore. I think, right now, from the standpoint of making sure we're safe on the capacity of our hospitals and make sure we continue to monitor these numbers like crazy, I think we're okay right now, but everybody's on high alert. I'll promise you all the antennas are up and everybody's really trying to watch this with all in them.
All right, thanks, Phil. Governor, I'll turn it back to you.
Well, again, I tried just to make, a few notes and everything. I want us to make sure, and I know we do this in every way, but through DHHR, we're really, really monitoring how we're going to do this in-home testing and to the quantity and reliability and all that. We're watching it and everything. Hope and pray that it will help, and it'll help a bunch, and still we'll be able to do it, and all the results will be really, really good. From the standpoint of just this, I overlooked, I apologize to you for doing, I overlooked, all the economic numbers that came out yesterday. I think, that's tremendously important for all of us within our state. I go back to just this, and I go back to this often to tell you just this, is what is my job? At the end of the day, what's my job? If you'll just really step back and think about it, first and foremost is to try to do everything within my power to keep you safe, to comfort you, to try absolutely to be respectful and appreciative for all the hard work that everyone's doing, to really monitor all the stuff and juggle all the balls, and to make sure with all in me that that we're following the guidance of our professionals and our experts and trying to do the right things. But a huge, huge part of my responsibilities as your governor is to make sure that the engine runs. That the engine runs and the money comes and the economics work. Because let's just step back. Let's just step back and think of Mark Curtis's question just a few minutes ago. What happens if we spend the money that the federal government has given us through the CARES Act, and what happens if we get to the end of the year and we've still got a real demand for testing or whatever the situation may be, PPE or whatever, and the feds don't move? What happens? What happens if someone pulls the plug and you're living on a razor's edge and you don't have anywhere to turn? Then you've got a catastrophe, do you not? Really, at the end of the day, the governor has got to watch after the store. The governor has got to perform economically to where the store is able to do all the stuff that we need to do. The store is able to provide additional services. The store is able to come up with dollars to be able to market ourselves. The store is able to absolutely promote and make more and more goodness come to West Virginia. These numbers that I read are the store, and they are so important, so important. At the end of the day, my job encompasses a lot of things. Get us through this pandemic, come up with the ideas, work with both sides, be creative, all that stuff, comfort, everything. But at the end of the day, my job is to run the store and make the store run at a level that is able to help and assist and promote and do all the goodness that will make us go better as time goes on. Those numbers are really, really important. Probably of all things, second to our losing of our people in this terrible pandemic, that's the most important. So anyway, nevertheless, I congratulate you, West Virginia, on making the numbers what they are. The store's in great shape, and we're going to continue to make sure the store's in good shape. So thank you a bunch. God bless each and every one of you.